Howdy, this is Jay Jackson, and this is my presentation on the Freeman Pediatric Partners workflow. And as you can tell, automatic fail. These are not centered. Poor presentation. So sample schedule, well child visit should take 30 minutes. If the family has multiple children that are being seen by pediatric partners, group them together so that the parents don't have to take extra trips to the office. And then stagger the sick child visits at the start of the well child visits at the beginning of the day, because they should take about 15 minutes. And then later on in the day at the end of the well child visits, because you can wrap up the well child visits early and then see the sick childs. And so the team, the pediatrician, room nurse, phone nurse, and then secretary and social worker. The secretary is the one that sees the patients whenever they first come into the office, helps them fill out the FREJA information, which ideally should be completed before they arrive to the office, which contains their health insurance information, address, phone number, and all that good stuff. And then the room nurse takes them from the waiting room, gets the vitals, and then puts them in the room. And then the social worker follows up if there are any SDOHs, and then the pediatrician goes in and sees them. So scheduling, staggering well child visits with sick child visits, and then leaving room for new patient visits, and then leaving room for the 1 week follow-ups from the newborn visits. Start of the day, show up at 8:30, 30 minutes prior, to review the charts with the nurses so that they know which patients showing up need to get which vaccines. And then as they are rooming the patients, they can have the consent forms for those vaccines ready for parents to sign. And then if they do not wish to sign or vaccinate, the pediatrician can go into the room knowing that will be a part of the conversation. Early morning coordination with the nurses should take about 15 minutes, and then we'll leave 15 minutes to sign off on any leftover documentation from the day before and follow up with the phone nurse on any calls that were made and any labs that have returned. Review the day's patient list so that you know what's coming. Okay, so the first patient, prioritize sick visits so that you can get them in and out, either admit them, give them drugs, or send them home. The nurses will room the patient, prepare vaccines, as discussed in the start of the day. Pediatrician will meet with the patient, go through all the well child visit developmental milestones, review safety, and then document as they do it. So at the end of their documentation, whenever the growth charts pull up, they can review the growth curves with the family. The pediatrician then presses print on the paperwork, and the nurse then comes in with that paperwork and the vaccines, gives the vaccines as the pediatrician leaves the room, and gives them their documentation of today's visit and sends them home. So the sick patients, how do you work those into the schedule? Like we said, start of the day, you see them first. Then you see the well child visits, and then throughout the day, sick patients, because you can't schedule sick patients in advance, mommy and daddy are going to call the office and ask to be seen. You're going to schedule that 15-minute sick visit at the end of a well child visit. Half the time, it can be managed with the phone nurse. If the phone nurse can't manage it, they will refer them to the secretary. Secretary will put them on the schedule for the afternoon, and then they will come in. The social worker, whenever patients have different problems like transportation, access to nutritional services, access to educational services, at the end of the visit, they'd be asked if they'd like to see the social worker, and then they can go back and work with the social worker. So at 12 o'clock, there's a 2-hour lunch. This allows the pediatrician to walk through the hospital. They pass the cafeteria, grab some lunch for 20 minutes, and then go do newborn evals. Also allows them to round on the admitted patients. So at 2 o'clock, whenever appointments start back up, same process. Start with the sick kid at 2 o'clock, then go to the well child visit, and then throughout the day, the sick patients will come in at the end of the well child visits. The last patient's visit should finish at 4:30, sign off on any charts that are not completed, thank the staff, everybody goes home at 5. Everybody has a wonderful day, end of day. So that's the pediatric workflow, and it was very efficient, and never experienced an issue where parents didn't feel like they had adequate time, and the pediatrician addressing their concerns and problems with their children. And thank you for listening, and that's my real world experience. I don't know if it helped, but have a wonderful day.